Hello everyone. There is one topic which has been asked to be quite a lot nowadays, that is tomato flu or tomato fever. I am Dr. Grivita Raikar, consultant pediatrician at Currae Hospital, both at Kapurbaudi as well as at Ghodbunder Road. So friends, let me just introduce you to the topic. Tomato flu or tomato fever gets its name from the skin lesions which are there on the scene mostly. It is a disease of children from 1 to 5 years of age. What is the hallmark is the blisters or the skin lesions which are noticed, and it starts mostly with fever, fatigue, malaise, skin rash, and generally the child is very much sick. Now the first case was detected in Kerala, Kollam, on the 6th of May 2022. The researchers are still trying to investigate as on what is the exact cause, but it is figured out to be a viral disease. Mostly the causative organism is most likely a virus called as the Coxsackie virus from the enterovirus group. So later on, it was initially in Kerala, which later on spread to neighboring districts of Odisha, Tamil Nadu, Maharashtra, as well as a few cases in Karnataka have also been reported as of now. The good part of the illness is it's a self-limiting disease. The disease has generally a course of around 7 to 10 days, max to max 12 days. But what is really concerning and we need to be really cautious about is that it has got a rapid spread. It is highly contagious and it affects children from the age group of 1 to 5 years mostly. So as I've already mentioned about the symptoms, it starts with fever, skin rash, your malaise, body ache, fatigue, vomiting, and in a few cases of even diarrhea has been reported. So the disease has to be ruled out from other diseases like HFMD, that is hand, foot, mouth disease. Secondly, chikungunya, and the normal COVID-19 with which we all are struggling for the past 2 years. So the symptoms appear. It is very important that you speak to your doctor, you get in touch with your pediatrician and get the proper medications. Okay, for me, I would say prevention is the best cure. So it is very important the child who is being diagnosed by the fever or by this particular illness should be kept in isolation. Seen to that the blisters are not broken, the blisters do not come in contact with the other children, because that is the most common mode of spread. Then isolation would actually help most of the things. It is very important that the child has been educated about the disease, told, so that even if the child, it is mostly seen to be spreading in the schools and in the daycares because of the close contacts. So in case if somebody is really affected, it should be seen to that as responsible parents, we should not send our children to school as well as to daycare centers and keep our children in isolation. Again, the most important thing is hand sanitization and frequent hand washing. This also helps to a great extent in prevention of the spread of the disease. And as far as the affected kids are concerned, it is very important that the fever is being taken care of properly. The symptomatic, if in case the fever is going very high, necessary antipyretic measures to be taken, and the child should be kept well hydrated, plenty of fluids to be given, and adequate rest. This would help you solve most of the problems. However, if the child is very small, it is very important that you are in frequent touch with a pediatrician so that the fever and the other parts associated with diarrhea and dehydration are well taken care of. So with this, I hope this video would be of real help to you. In any case, you could get in touch with us. Thank you so much.